All right, guys, how do we hack into our 24-hour cortisol curve to beat insomnia? So here's how. So this is your 24-hour cortisol curve. As you can see, it's much higher in the morning, much lower at night in a 24-hour period in a given day. So basically what you want to do is you want this curve to be enhanced and optimized for you to then be able to sleep best at night. And so you want to avoid things that are going to spike your cortisol at this time when you're getting ready for bedtime, okay? So number one, the most important thing you want to avoid doing at this time or the odd hours of the night is doing anything strenuous, which is any sort of high intensity interval training exercise, zone 5 exercise where you're hitting close to 90 to 100% of your heart rate. Because remember, those exercises use glucose as a primary source of fuel. And so as a result, your body is gonna spike its cortisol and its catecholamines to then mobilize blood glucose to get you through that workout. Problem is, now you have that cortisol right there, it's gonna interfere with your melatonin at night, it's gonna interfere with your growth hormone at night, it's gonna interfere with your deep sleep at night, and by interfering with your deep sleep, it's not gonna allow you to get restful recovery. Other things you wanna do is you wanna avoid bright lights at this time are gonna keep you up, they're gonna disrupt your melatonin, your growth hormone, and not allow you to go to sleep and get restful sleep. The same token, you wanna avoid using your phone, generally about 2 hours before bedtime, and keep your settings on low so you're not getting that activation at that time. You wanna avoid anything that's stressful, so you wanna have an environment that's calm, nourishing. You wanna focus on mindfulness, breathing, yoga, meditation. These are things you wanna do at this time. If you follow your circadian rhythms in terms of your cortisol and your melatonin curves, and you avoid things here that are gonna then disrupt your circadian rhythm, that's literally how I treat about 90% of my patients with insomnia. You also need to look at people's nighttime routine in terms of what they're taking. Sometimes people are taking a lot of melatonin, which is gonna then cause daytime grogginess and affect this part of our cortisol awakening response the following day. And so another important thing about beating insomnia is trying to enhance your cortisol awakening response, okay? If you have a better cortisol awakening response, you're gonna have a more blunted and lower cortisol response later in the night. And things you can do to have an enhanced cortisol awakening response would be getting morning sunlight, avoiding caffeine for about 60 minutes after you wake up, light to moderate exercise in the morning, and then moving your body in some way is gonna help improve your cortisol awakening response, which is then gonna lead to a lower cortisol curve later in the day and help you get restful sleep. So if you're not sure why you can't sleep and you're having insomnia, start here. Do a 24-hour salivary or urinary cortisol test, see where the issue is, fix that issue. 9 times out of 10, that will actually fix your insomnia as opposed to just treating insomnia like a symptom. Think of it as an imbalance of your natural circadian rhythm formed by your natural cortisol curve, natural melatonin curve, and natural growth hormone curve.